Welcome to United Way Community Connections. We're glad you're watching this program with us, and I want to thank all of our viewers for your kind comments. I know you do watch us, and I've heard that, and I do appreciate that. And today my guest is Allison Ogden, the Executive Director of the Four Rivers Behavioral Health Care, right? Or Health Services. Mm-hmm. So Allison, we're glad you're here with us, and if you'll just give the folks a little bit of history, a little bit of background about your agency, so they'll catch up and be familiar with the new term.
Okay, thank you very much, June, and we appreciated the invitation to join you today. Four Rivers Behavioral Health has been a name we've been doing business as for the past almost 10 years now. Originally, we were founded 40 years ago, which not everyone knows, as Western Kentucky Regional Mental Health Mental Retardation Board. So we've been in the community for 40 years. This is our 40th anniversary, which we're just about to celebrate in 2006. But what's interesting, June, was that we were founded as part of a large national movement of community mental health centers, founded by and initiated by President Kennedy in one of his last acts. Prior to his death, he signed the Community Mental Health Center Act, which was to bring services to individuals in a community-based form rather than in institutional placements or private care. So many services were not accessible to individuals in the community for many years prior to that.
So for 40 years we've had you all, and you're still here and growing. I know just in my time here you've grown so very much, and offering services, a lot of different services probably than you started with.
Yes, things have changed, I think, but what hasn't changed is the core mission and values of the organization. It was to bring regionally responsive services, state-of-the-art services to the community. And that's been the guiding principle, I think, for the staff and the boards and the directors in the past 40 years. Although, you know, our business plan has probably changed, our funding resources certainly have changed because we were initially federally funded. Interestingly enough, the predecessor of the United Way was one of our original funding sources 40 years ago as a local supporter. Very active in the community. When you go back and look in our archives, that was kind of a who's who of Paducah at the time that helped start the organization. Yeah. And brought the services here. Started in a small way. We serve 9 counties, always have, in Western Kentucky, besides McCracken County.
So you're just not McCracken County, you're a regional actually. You reach out and you have satellite offices there, am I right in some of them?
Full-time offices in 4 of our counties, but we provide services in all of our counties, on-site services, either through schools, jails, the Department of Community-Based Services, through DCBS. Sometimes in smaller offices, depending on the location. But we do go into every county. We provide a lot of on-site services, although we haven't been able to, because of funding sources, maintain full-time offices in each county any longer.
Well, I think a lot of the organizations are finding that that is just not feasible any longer to have those satellite offices full-time because of a lot of reasons, and funding certainly, and staffing of them. It's not that the need is not there, but it's just not feasible, and so they're bringing it back
well, what we're trying to do is develop hubs of service, so that out of those areas then we send staff to the communities to provide services so that they're more accessible to the individuals who have issues with transportation, et cetera.
And that is a problem. Transportation has been one of the larger issues in the assessments that we have done, because people are just not, even in the Paducah area itself, folks are just not able to get to doctor's appointments and that sort of thing. So it's good that you are finding those avenues of service to those folks, because they do desperately need that. What are some of your services? I know you are very, very broad because you have many, many programs and services just under the Four Rivers.
That's correct. Originally, like I mentioned before, we started off with our two primary service areas being mental health and mental retardation, developmental disabilities. In 1976, the funding changed to include substance abuse services. And so that became the third arm of our service array. We have various services within each of those divisions with an emphasis on there not being a wrong door, so that individuals, when they come in, will be assessed based on what their individual needs, rather than, hopefully, our emphasis is not to pigeonhole them in one program.
one place, yeah.
Because people present with various issues that may cross those lines. So we provide the traditional services of outpatient services, individual therapy, group therapy, family therapy, but also some specialty programs, including residential programs for some services. Developmental disabilities, we have a full array of residential services, respite services, relief services. With mental health, we have some specialty services, targeted case management for adults and for children. We also have a partial hospitalization program for children, which I'll talk about in a little bit. We have residential substance abuse treatment with detox and residential treatment, 28-day treatment program.
Is that the one in Mayfield
That's
in
right.
Graves
That's at the
County
William
that
H.
you
Fuller
have?
Center.
Okay.
As well as outpatient follow-up services. And our newest in our array is the crisis stabilization units that we have for children and for adults. The program for children is not a unit per se, but again, it incorporates the opportunity for children to be managed in a crisis without having to go to a higher level of care and a hospitalization that takes them away from home and their schools. So that is another new one. And we also, for adults as well, where hopefully we're preventing, again, adults from having to go to a higher level of care and hospitalization, and that's the intent of that service.
So you really serve the entire family and their needs, because as all of us well know, it's not just one person in the family that's affected by any situation. It's the entire family, and so you offer then the family counseling. Do you have
Yes.
groups
Yes.
with that? Two of the programs that I'm more familiar with, besides the Children's Partial Hospitalization Program, the Friedman Center, and then the Riverwood Group Home that is here, that is under your umbrella, that you all provide services and case management there. And I know the men's transition home has been a wonderful avenue for those men coming out of a treatment, and because most folks don't realize how hard it is to get back into the community, into work, family life, and so that has allowed them. And I know we have been, United Way has been involved with that, and there are just many success stories.
The Friedman Center was established in the early 80s as it's licensed as a transitional living center for men. It's only 10 beds, and men come to us after they've finished residential treatment currently. That is an opportunity, like you said, to become reestablished in the community. Oftentimes because of addictions, people have lost their connections, whether it's a job, it's connections with their family, connections with their own self-esteem, and they need a structured living environment to kind of get their feet on the ground again, to get reestablished in the workforce, go to school, get the training, develop the daily living skills, or reestablish those daily living skills that
and
they
some
once
of them
had.
never learned those.
That's right.
In talking with some of the fellows there, they just never learned those skills. It was covered up with either alcohol or the drug abuse, so they really are having to, like a child, learn them from the very beginning. And for most of we adults, we tend to think that that's only children that have to go through that. But it's amazing to me the number of success stories that you have coming from there, because many of them I've talked with personally, and they are just able to survive sober, and that they have very few sober friends when they go into treatment, I would think, and so they've lived that life, and now then they're just having to build a new life, it would seem.
Exactly. And many of the individuals have come back to work for us to give support and lend support to the new fellows coming in, which is a critical piece of the program.
Oh, I agree.
in the mentoring and the peer supports that they get, and the examples that these fellows set for the
It has to give them something to shoot for and something that says, I can do it, they have done it. And so I think what better folks could you have to come back and work with them, because they know they've been there, they know exactly some of the things they're going through. So I think that's a wonderful tribute to the overall service in the program, and to know that we have that right here in our community it's reassuring. I wish there were more, and I understand there's going to be something new coming along. You want to just brag about that and talk about it?
Last 2 years ago, Governor Fletcher began an initiative as part of his concerns and issues about substance abuse and ongoing substance use in the state of Kentucky. And a funding package with many, many different sources of funding was brought together to establish 10 recovery centers throughout the state. There are 2 in each congressional district, one for men and one for women. And it's, while not being a licensed treatment program, it is a drug-free housing program with education and supports, kind of building on some of the models of the transitional living program.
Okay.
Although the individuals would go elsewhere for the treatment component. This will be a drug-free housing that has strong educational component, learning about your disease, learning about the recovery and how to manage yourself, get yourself reestablished again in the community. But the exciting part is that it's going to serve up to 100 men. And Paducah was fortunate enough, with the supports of Mayor Paxton and Judge Orzine, we were granted an award here for establishment of a recovery center. So it will be a separate corporation under Four Rivers Management, and we've worked with the PAD office too in the development. So it's been a community endeavor that will be the lead partner and eventually take over full ownership of it in the years to come. But this will give us an opportunity to serve. And the good thing is too that there's also our sister organization in the Pennyroyal District will have a similar facility for women.
And I think that is one of the greater needs that I hear. There's nothing for women, there's nothing. So that's exciting that at least near enough to our area, there's going to be a facility. Is it going to be the same size, or will it be similar to the one that will be here?
It'll be almost identical in scope, but will serve women rather than men. And it is going to be not just for the region, it will be for the entire congressional district. So it'll be available. It's also an opportunity to divert people that have an addiction from the criminal justice system, if that's the only issue that they're facing with nonviolent criminal offenders, because they've been, their addiction is controlling their life. This gives them an opportunity under supervision to get a second chance.
Okay. Will it be necessary for the men that come to the new center to have gone through the 28-day program?
No.
So they can come directly there.
And part of the process will be to assess what their clinical needs are too. So that, because we'll be involved, all of our other services are available to the residents there. So they'll be able to be integrated and hopefully linked with what clinical services they need, regardless of whether it's substance abuse or mental health or other issues that they need to address. The full array will be part of their assessment process.
It's exciting, Allison. And tell us where your facility is going to be.
It will be located on Coleman Road, adjacent to the Juvenile Detention Center, and we're hoping that it will be completed within the next year.
That is wonderful. just think going from serving the 10 at the transitional center to 100 there. Now, will this be incorporated with the Friedman Center? Will that still be in existence?
Probably not in the long term. For the short term, obviously, we'll have the program available until we replace it with this new development. So there'll be a transition as well.
A time of transitioning in that, and then they will move to probably one facility.
Correct.
That is so wonderful, and I think our area is very fortunate to have this in Paducah area, and you've got plenty of space there, I understand, and so
Yes.
that will be helpful, particularly if there's plans in the years to come for expansion. And unfortunately, I don't see any lessening of the drug situation and the mental health, because I know mental health is a great issue with the folks we talk with, multiple issues in addition to the addictions and or the mental health issues. So I appreciate the fact that that we are going to have this facility, and I think it'll make a great deal of difference. And I know that you all will run it well. You always have. And so I think that is something that we can all look forward to and be very grateful for. So thank you all for taking on this task of
Well,
of
like I said,
getting
we have a lot
started.
of community support in planning this initiative, and we couldn't have done it without the city and county governments and the encouragement of Paducah Bank and the staff of the Purchase Area Development District. And I'm probably leaving many partners out, but
Well, it has to be an entire community effort because it's a community problem.
Correct.
And if everybody puts all their thoughts and their funding and the grant availability together and the expertise, then it's got to be a go for all of us. We'll switch gears now and move to the children, which United Way is beginning to have a part in the children's hospitalization, partial children's hospitalization program. Tell me, how did this come about? Because have you always had this?
no. The Children's Partial Hospitalization Program, Four Rivers began the program when Charter Hospital closed here in
I
Paducah.
remember that time.
Charter Hospital did have that as a service that they offered, and when they closed, we felt that it was a service that the community needed and stepped in to provide it with a pretty short-lived gap in service, I think.
I remember now because it was not a long period of time before you and I were talking, and United Way had put together a grant for you to get that off the ground and started, because those apparently those families that were affected by that closing needed some
Immediate
services, yes, right then. So
And that was very helpful. The Emerging Needs Grant that the United Way gave us for seed money to initiate that program until we could, because it's a fee-for-service program, that initiated our being able to set up the space and get the equipment that we needed and hire the staff to begin the program. Program has grown since then. It's now not only an integral part of our children's services, but it's also a part of our crisis response for children now as well. And it's a day program. It operates year-round. Children come to us 7 hours a day during the school year. 5 of those hours are in therapeutic activities and treatment, and 2 hours they're in school. It's a collaborative effort with the Paducah City Schools, and the children they provide us teachers, and the children are considered the same as homebound children.
okay.
So that they're able, regardless of where they come from, whether it's in the Paducah City school systems, because we have children from other counties and other systems as well that come there. The teachers work with their home schools, get their curriculum, keep them, do remedial work, or assist them with keeping up with their schoolwork, so that while they're in treatment, which can last anywhere from 8 to 12 weeks, they don't fall behind on their schoolwork.
Okay.
and or they're helped and given a lot of individual attention for things they may have been having problems with in the classroom, which led to problem behaviors, frustrations, self-esteem issues, etc. But these are children that are at risk and have been at risk for having to go to a higher level of care, and that means hospitalization, which means going away from school, going away from home, leaving their families. Families are a very strong, integral part of the program through daily reports from the parents. They're involved in family therapy. They're involved in their own therapies if they need it. And that's all part of the process. But we have, licensed clinical master's degree professionals that run the program with an RNC coordinator, our psychiatric nurse that is the coordinator of the program with a lot of years of experience. And so we have, during the summer when school's not in session, then they have a 5-hour program. The therapies continue, they just don't have to go to school.
They don't have the school time, okay.
Correct.
How do they come to you? How are they referred, and just walk us through the steps of
From many
the
different
referrals.
sources. We may get referrals from the school systems, we get referrals from pediatricians, we get self-referrals from families, we get referrals from our own clinicians, from private practice clinicians, from the Department of Community-Based Services, DCBS would refer children. So it's a myriad of places, and there is a referral process. And they don't have to be an existing client of our agency in order to qualify for the program.
Okay.
They can come directly to that program once they're assessed.
All right. What are some of the issues that you see in these children and the ages that you serve?
We serve from usually 8 or 9 years old to 17 are the primary age groups. And now in the classrooms they're separated, the adolescents from the elementary school, just because of the education component. So we have 2 separate classrooms. However, most of the children are going through either situational stressors with their families, with themselves, sometimes emerging depression, sometimes emerging major mental illnesses. Usually they're being presented in acting out behaviors, aggressive behaviors. So that's a focus in learning social skills, learning to manage your feelings, learning to handle them more appropriately, and also working with the families so that they reinforce the positive things that the children learn in the program. It's a very structured program. They have a level system where they earn privileges based on how they manage themselves and their schoolwork, etc. And so part of it is to assist kids in identifying what their issues are, as well as learning coping skills in managing them.
So they're 8 years old, or 8 to 9 in that area, and
Up to 17.
and up to 17, and then do they work through steps in the program, and
Yes.
then they're done with it when their behaviors change, or
they've
how
reached
do
their
they
goals.
how do they reach their okay? So they reach those goals then, and then they go back into the schools
Correct.
or the situations that they've come
But
to you from.
they're going home every night. They're still with their families. They get to practice in those environments. Parents send a daily report back on how things go every night or
So
over the
that's
weekend.
required of the families then. That's a very good thing, I think, because so many of the behavior problems, I think, that I have seen and witnessed, a lot of it is family, the lack of family interaction, I think. So
Or,
that's
there are
good too.
sometimes there are parents that are overwhelmed and don't quite know how to handle all
Exactly.
this. And they need the assistance
Yeah.
and support that what they're doing is
Yeah.
the right thing to do and how to stick with it. And they're encouraged and learn new ways of coping too, and new child rearing techniques that hopefully benefit the whole family,
Oh, I'm
because
sure.
many of our children are not only siblings, or they have other siblings.
Yeah. Good. Do you have oftentimes multiple children from the same family, or more than one?
We may treat them, but we wouldn't treat them in the program
In
at the same time.
at the same time. Yeah. Well, I think that makes a lot of sense to me, because I know how siblings are. So I think that it probably works out to the better for all of them. My connection, of course, and my first knowing of the program really in depth has been through the United Way grants to you, and basically the last 2 to 3 years, I think, we have funded this program, or not funded the total program, but provided funds for copay for those families who do not have the funds to pay
Correct.
for the services there and yet need them. And so I am glad that we can have a part in that. I'm glad it started the program, because I know when charter closed, there was those fear issues, I think, in the entire community. And the fact that you all stepped to the plate and recognized that this is a great need and somebody has to meet it. So we're glad to be a part of that with you in the partnership with the program funding. Any last comments before we wrap up our time together today?
Well, I appreciate the opportunity to share our story. We don't always get an opportunity to do that, and I think probably the last thing that I hope to leave is that, you know, we are community-based care. Our goal and our mission is to help people have happier, healthier lives in the community and not need to receive services separate from their lives, their families, and hopefully improve the quality of life.
Well, I think overall it's going to improve the quality of life of the entire community, and to have, and particularly in the school system, because in the children's programs, because of your services to them, I think it makes, I'm sure the teachers love you, so that makes a great deal of difference too.
I think they wish there were more of us.
I'm sure.
And certainly I do too. But last year we served in our 3 programs a total of 10,000 people.
Oh, that's a lot of people.
And, you know, and frankly, there's a greater need than that.
Oh,
Still.
there's always a greater need than what we have, the services, the staffing, the facilities, everything to do the programs well. I know there are folks out there. Do you have a waiting list for your
No.
services, any of them?
Not per se.
Okay.
It may take a while depending on what the need is. People could be seen today if it's an emergency. And we try to accommodate, you know, people's lives and with the appointments. But we don't maintain waiting lists per se, other than in our residential programs where we have fewer openings.
Yeah, I would think so. So maybe when the new facility is completed, then that's going to open some doors there. So we're just very, very pleased for that. And just congratulate you on 40 years of service to our community, and on long term. And we hope that you continue and things go well with all your services. And I appreciate your services to our community and to United Way particularly. And so hopefully we'll see some good things in the days to come. So thank you for coming along and explaining some of the programs that a lot of folks don't realize we have right here in our community.
Thank you.
So thank you very much, and thank you all for joining us for United Way Community Connections, and we hope that if you have questions, you'll call the United Way office at 442-1691. Thank you very much.